In this set of slides, I'd like to talk about just focus groups, what they are, how you do them, and how they've been used. And specifically, I'd like to give you in this batch an idea of how I've used them in my work with cancer survivorship. But let's begin by talking about what is a focus group. And many of you have probably been a part of focus groups or maybe even conducted a focus group. And it's like an interview or a group interview. It's this idea of a guided discussion with a small group of participants. And what you're trying to do is explore things and gather at the same time in-depth qualitative information like you would during an interview. But you're doing it with more people. And the goal of a focus group is that you're trying to provoke discussion within this idea of a group dynamics. And you're trying to find out what's going on, what is the range of salient issues or opinions in a group, how are people impacted by issues or products or preferences, and what suggestions and insights they might have. Now, just because you have a group together does not mean that you go for consensus. Again, this is not a representative group. It's a group of people that you've just pulled together. It might be 2 to 8 people even, or 3 to 8 people. But you're just trying to get more of an interaction, more of a discussion going, as opposed to just one person's in-depth story. So how have I used these? This is a real world example from some of my research with cancer survivorship. And it has to do with cancer survivor plans. So just a little bit of background. Survivorship is defined as something that happens from diagnosis through the end of someone's life. So when somebody experiences cancer and they finish treatment, that doesn't necessarily mean that they are done with their cancer. It's this idea of surviving and being followed up and really surviving for the rest of your life as somebody living with the experience of cancer. And so that can have many ramifications physically, mentally, and socially and spiritually. So in 2004, when we were working on this study, nearly 11 million survivors were in the United States, and that's way more now. So treatment can stop the progression, but there's also late and long-term effects from the treatment and from the cancer itself, but mainly from the treatment. We've all know people who've gone through chemotherapy or radiation, and there are things that they have to look out for or get tested for the rest of their lives. So the Institute of Medicine, the IOM, had a report that was called From Cancer Patient to Cancer Survivor, Lost in Transition. And they found that there were a lot of gaps in health care for people who were surviving cancer. So when you're going through cancer, you often see an oncologist. And when the oncologist deems it okay for you to be sort of handed off to your primary care physician, like, I'm done, you are done with your cancer, and now you can go back to your regular doctor, there's often a loss of follow-up. There's a lack of coordination of this cancer care from cancer care to a primary care physician, because the primary care physicians might not even be a part of a cancer experience. And so you go back to this doctor who knows nothing about what you've been through with your cancer, and there's just this lack of coordination for follow-up for a lot of different things. There's also a lack of recommendations for follow-up and surveillance of cancer. So the recommendation was that the oncologist would develop something called a cancer care plan and answer questions and develop this sort of history, a document of history of the cancer experience or the cancer treatment that would facilitate communication across providers that might see a patient and empower survivors with the information about their cancer care. So wherever they went, they had this documentation. But they're really difficult to fill out, and they're difficult to understand what is the most important information that needs to be on these things. So here's an example from the American Cancer Society on a cancer care plan. So part one would have to do with just the cancer itself, the physical things, family history, what kind of surgery they had, what kind of tumor it was, where it was staged, what kind of treatment was received, other things like that. The second part of the plan is supposed to give some idea of follow-up and surveillance for the person. So what kind of follow-up tests they should be getting, what regimens they should have, what follow-up, and how to manage their schedule with follow-up. Should they have a mammogram more often if they have breast cancer or less often? What are the risks for recurrence? What symptoms they might have recur, or late stage side effects from their treatment, things like that. And this type of a plan and type of a document can actually give information to decrease uncertainty for the providers and for the patients so that they have better quality of life. So the purpose of our project was to gain perspectives about survivorship from minority breast cancer survivors in urban southeast community of Florida, where I was working at the time, and to understand their reactions to these cancer survivorship care plans, and to learn how survivorship care plans might be improved from their perspective. So we conducted 4 focus groups, and each involved about 6 to 12 participants. And we did purposeful sampling. They had to be 18 and less than 65 because of Medicare. They had to be a breast cancer survivor, and they had to have been done with their initial or active treatment, such as the surgery they might get from their breast cancer, chemotherapy, or initial radiation, just so we can get an idea of, what would they get in a survivor care plan. So for recruitment, what we did was we put out flyers that had a toll-free number for them to call and see if they were eligible to be a part of the study. We also did word of mouth. So we called different cancer networks. There was something called the Sisters Breast Cancer Network, and we called local clinics to ask them to hand out our flyers and put it on their social media and talk about our project. We also had things that were incentives and enablers. An incentive is not something that is a compensation in terms of endorsing somebody to come into the project. It's something to thank them for their time. So our incentive was a $50 Walmart gift card, which we thought would be good because it's about a 2-hour, time that they would spend with us, about $25 an hour. So it's not something that would make them feel like they can't say no to being in our project, but enough to say I was appreciated. We also gave dinner, and that was an enabler because we were doing these in the evening to make it easier for people to be a part of the project. We wanted to give them some food so they felt comfortable. We also, with permission, audio taped all the focus groups. So our agenda for our time together with our participants was that they arrived, we had a little dinner, and we socialized. We introduced our study, explaining the purpose, the methods, how we would try to maintain confidentiality within the law. We developed ground rules for allowing people to talk, and we made it clear that opinions were valued, and it was okay to have an opinion that wasn't like everybody else's. We did an icebreaker with individual introductions, and then we started our focus group, which was about an hour. And we had this idea of doing 3 cards. We had 3 questions that we really wanted to focus on in our focus group. And then, so everybody got these 3 cards, and they got our questions, and they could write notes to themselves. So the first question that they could just sort of think about for themselves was, what did your oncologist or your cancer doctor tell you about how to care for yourself at the end of your active cancer treatment? Another question was, what do you wish your oncologist would have told you about how to take care of yourself? And then after discussing those, we asked them to look at a cancer care plan and tell us what they thought about it. So an example of some of our discussion from the first question of what did their oncologist tell them was, I was told nothing, that for me to see him back in 3 months, we didn't know what to ask. I was just in shock because I'm thinking, you're the doctor, you're supposed to tell me what's going on. With the idea of what do you wish your oncologist would have told you, it was a year or maybe 2. I developed something called lymphedema and wasn't told about that. I didn't know it was a result of breast cancer. And then we showed them these cancer care plans, the survivorship care plans, and we asked them what they thought about it, positive and negative. And one person said, this is really heaven sent, not just for breast cancer survivors, but for any sort of cancer. So what we learned, in terms of, doing focus groups, not even what we learned from the data, was that it helped us to recruit via a community champion, like the network that we went through. Not just giving out flyers and putting flyers up, but to actually have clinics and trusted networks help us recruit. The participants appreciated having a toll-free number that they could call to be a part of our project. They really liked the $50 in the dinner, and they liked the idea that they were being asked about their issues. We found that the tape recording was not something that they had a problem with. It was not something that was disruptive. And for us, it was important to have both note takers and observers to pick up nonverbal cues. So when we're talking about focus groups, and we'll talk about this a bit more, it's really important to be able to have somebody there who can help you, really help facilitate the focus group. Make sure your people aren't upset, or if they are, that there's some caregiving going on. And, really noting, when are people getting upset, or when are people most happy, or when are they agreeing, when are they saying, maybe they're not saying anything, but they're agreeing or they're not agreeing. Those are very important things for nonverbal cues. The 3-card method worked really well. Everyone had something to say or add because they had a chance to think about it before we got into the discussion. So it's not like this wouldn't work for everybody or for every focus group, but sometimes there's a lull in discussion, and they'd already written out their notes. So if we just gave them some time, people always had something to add. We did have to facilitate, sometimes gently prompting folks to say, I haven't heard you, or could you please let somebody else have a say in what's going on, was really helpful too. It's a challenge to moderate a group when you are very much involved in that research. So it's hard to remain unbiased. And again, we've talked about this before. When we're doing advocacy research, it's really easy to get caught up. And so we had to really sit back and try to make sure we let people discuss. But it's okay sometimes to say, I've heard this before, or a lot of people agree with what you're saying. And we had to be prepared for emotional responses. For this type of research, even though we're talking about survivorship, we're still talking about something that is really, really near and dear to people's hearts. And they're still going through this cancer experience, and they're still going through, like that woman said, lymphedema and things like that. And so being prepared for that, making sure there are caregivers around, or that we say out loud, if you need to take a break, please let us know, or having Kleenex around is really important. Unintended consequences were that even though focus groups are not therapy, people can connect. They shared important information. They shared their contact information with each other. And the Sisters Network that we went through actually recruited more women who weren't in that but had taken part in our interviews. And they also told us they really enjoyed themselves. So sometimes it's really good to ask, about the process, not just about your research questions, but about the process. Was this a good thing for you? Do you have any suggestions on how even doing this research might be better? Because we never want to go in and hurt anybody or do any harm. And so it's always good to know that they enjoyed themselves or they got something out of it. So that's just one example of some focus group research that I've done. And I'll go on in our next set of slides to talk about sort of the nitty-gritty of doing focus groups.